All right, welcome back. I'm Dana Smith. Thank you for sticking with us for Live Impact News. We're now going to turn to a topic that a lot of people have been talking about lately, these food recalls, whether it's the iceberg lettuce. We had an issue with jalapenos. So right now we're joined by an expert. We have Kelsey Holloman. She is the Foodborne Disease Epidemiology Program Manager from the Virginia Department of Health. Kelsey, thank you so much for joining us. It's such a pleasure to have you.
Yeah, thank you for having me today.
Absolutely. Let's dive right into it. So I guess a question a lot of people have been wondering is, are we seeing more food recalls? Have they increased? What's going on?
Yeah, so data from our federal agencies, such as the Food and Drug Administration, or FDA, and the U.S. Department of Agriculture, or USDA, do show that recalls in the volume of affected products has increased over recent years. With that, recalls may also seem more common now, though, because of better tracking and testing methods for these products. And then most recalls are most of the time due to undeclared allergens, foreign objects, and bacterial contamination, like in this situation with the jalapenos, the salmonella being in the jalapenos, and the cyclosporiasis being in the iceberg lettuce recently.
Right. You had mentioned, our detection. I guess it leads to the question of, is our food becoming more unsafe, or is our detection becoming better when it comes to these food recalls?
Well, I don't have the data to say right now if our food is more unsafe. I do know that we do have much better detection methods. We are able to much better link cases, human cases, and human illnesses of certain foodborne conditions to food, especially pathogens in food that may be detected via that testing. And then I will say that as we continue to have just a need and demand for fresh produce and things like that year round, we come into the point where we have a lot more produce and fresh fruits and vegetable items being imported from other countries and things like that. So that's really kind of where we see a lot of these issues arising as of now.
Absolutely. Thanks, Kelsey. So, what is this difference between a food being recalled because of a potential contamination or a recall that's tied to a confirmed illness? Is one where you kind of have an idea there may be salmonella on the jalapenos, or are we waiting for someone to get sick? What is the difference between that?
Yeah, so it's kind of a combination of both, like you said. So a potential contamination recall means a food product is removed from the market because the testing or the supply chain tracking indicates there is a possible risk of a hazard, somewhat like a bacteria or undeclared allergens. In those potential contamination recall situations, at that time, no confirmed human illnesses are necessarily reported or linked to the product yet at that time of the recall. And in those situations, consumers really want to check those UPC codes and the best by dates on those products, discard them or return them immediately to the store where they purchased them from to prevent that potential exposure. And now on the other hand, with a confirmed illness recall, that means multiple people have already been reported to be diagnosed with an illness linked to consuming that specific food. So in this situation, our public health agencies like the CDC and FDA have tracked and verified multiple cases of similar foodborne illness among people from different households. And in those situations, again, consumers want to check their recalled products if they have them in their home or possibly consume them. They should treat those recalls with high urgency and kind of heed those warnings against consuming and serving those affected food items while those investigations continue.
Yeah, you brought up a really good point, the importance of taking recalls seriously. When we
Yes.
have these back-to-back recalls, do you think people ever get a little bit of fatigue? They hear it and they go, oh, here's another recall. I just bought some jalapenos. I just bought some lettuce. Do you see that among consumers where maybe we're not taking it as seriously when we have two back-to-back issues?
Yeah, there definitely could be some kind of recall fatigue and people just, well, what can we eat now or what is safe for us? But in those situations, again, we always advise people to remain as vigilant as they possibly can. We want people to monitor the FDA and USDA recall website so that can remain up to date on any recalls for products that they may have purchased or consumed. And so we really just want people to maintain and make sure that they are kind of staying up to date on those active recalls to make sure that they are not consuming something that can potentially make them sick. So in addition to the FDA and USDA recall websites, consumers can also visit our VDH website at vdh.virginia.gov, as well as the social media outlets for our partners at the CDC, FDA, and USDA, as well as the Virginia Department of Health, because we do repost and share all of those recall notices that come out that are linked to human illnesses.
Absolutely. I guess my other question is, what happens if you already ate it? You had a salad, you had some jalapenos and some fresh iceberg lettuce. It was delicious. You ate it, and then you hear about a recall. What should you do?
Yeah, in those situations, you really just want to monitor yourself. If you do start to have any signs or symptoms of a foodborne illness, especially a foodborne illness, let's say, that is linked to a particular recalled food item like the salmonella in jalapenos or cyclospora in the iceberg lettuce, you want to monitor yourself for those symptoms. And then if you have any of those symptoms for a prolonged period of time, especially things like watery diarrhea, that's when people really want to go and seek medical care and hopefully and possibly get tested for a foodborne illness and be treated as well.
Are there certain groups, children, the elderly, who are maybe more susceptible, people with weakened immune systems, who should really be paying attention to these recalls?
Yes, definitely. So typically, the average person who is healthy will, get better without a lot of treatment and things like that. But those folks who are in those kind of high risk categories for severe outcomes include small children, older adults, and people with weakened immune systems. So they definitely want to remain vigilant with monitoring their health and their symptoms and seeking that medical care if they develop any symptoms.
Yeah, thank you so much, Kelsey. I think it's interesting what you said about how we're just becoming better at finding these problems before they actually make it to store shelves. Those detection systems where there can be that voluntary recall where there may be an issue. And it's interesting because it could be a disease like salmonella, cyclosporiasis, but sometimes it's just like even plastic bits, right? Can get kind of caught up in something in the manufacturing. You know, both are important, right? Whether it's because they think
Definitely.
there's glass or plastic in the food or an actual, living organism.
Yes, they both are very important. So like you said, those, plastic pieces and things like that that may come into a product during manufacturing. And then also another one that is severely important is any undeclared allergen recalls as well. So especially things like, nuts, tree
Mic check
nuts,
one,
or,
two, three, four, five, six, seven,
undeclared
eight,
egg
nine,
items and
10.
things like that.
I'm going to count in different languages
Have
again.
very severe
Okay.
allergies and allergic
Mic check
reactions,
two.
especially anaphylaxis to those particular allergens.
Yeah, absolutely. Okay, before I let you go, thanks so much, Kelsey. I don't want to take up too much of your time.
Thank
What's
you.
the one takeaway? What's your one message for consumers who are hearing about these food recalls, dealing with these food recalls? What is the one thing you want people to take away from this interview, people listening in?
Yeah, people should take those recalls seriously. Again, monitor yourself for any symptoms. Stay up to date on those recalled food items by going to the FDA, USDA websites. As well as, again, monitoring yourself for symptoms. And if you have any symptoms for a prolonged period of time, visit your healthcare provider. And I always can't stress enough the importance of hand washing. I always just like to stress that whenever I have time with the news media to provide that information to the public. So you always want to wash your hands before and after preparing food and after using the bathroom or changing diapers. That really, really helps reduce the amount of foodborne illness that is transmitted within our community.
Oh, I'm right there with you, Kelsey. I remember back the COVID-19 pandemic, we learned you sing happy birthday. Make sure you get the back.
Row,
get the
row your
nails.
boat, all of them. Yeah.
You got to make sure the hands are clean, especially
Yes.
when dealing with food. Whether you're eating it yourself, you're preparing it for your family, for other people, wash those hands. You know, food recalls are important. Try not to get fatigued by this. You know, when we hear about it's one thing, it's another, it seems like it's back to back. It's important, and it's especially important to pay attention to all of this. All right. Thanks, Kelsey. I so appreciate you taking the time.